Hello there, assalamu alaikum warahmatullahi ta'ala wa barakatuh. This is shayawu Mariam and it's 5 minutes with shayawu Mariam. Today I'm going to talk about a serious health condition which is common in our community. That is renal failure. When you hear the term renal, it simply refers to anything that has to do with the kidneys. For us to know what renal failure is all about, we need to know our kidneys and its functions. Kidneys are two bean-shaped organs located just below our rib cage. They are a size of a fist, and one is located on the right side of the spine and the other on the left side of the spine. The kidney is very important for the proper function of our body. It filters our blood and gets rid of waste and toxins which we pass out through our urine. The kidney also produces hormones that regulate our blood pressure, production of red blood cells, and conversion of vitamin D into its active form for the formation of healthy bones. When our kidney fails to function, toxins build up in our bodies and cause a lot of complications. Renal failure is when our kidney is unable to perform its function, which is getting rid of toxins and waste substances from the blood. There are two main types of renal failure, and these are acute renal failure and chronic renal failure. Acute renal failure is simply when our kidneys is not able to function properly suddenly. The key term here is suddenly. That's what separates the acute from the chronic, because in chronic acute renal failure, the failure occurs over some period of time, but acute, it occurs suddenly. In this video, I'm going to talk more about acute failure and tackle chronic failure in our next video. So what is acute renal failure? Acute renal failure occurs, as I said earlier on, when our kidneys suddenly stop functioning. This is mostly caused by three conditions in our body. That is when there is a condition that leads to poor blood flow to the kidneys, when there is a direct damage to the kidneys, and when urine is not able to get out of the kidneys. Conditions that sometimes cause blood flow to slow up. Acute renal failure mostly occurs in association with other health conditions. Your risk of getting acute renal failure is high if you are diabetic, you have heart failure, you are of an advanced age, or you have high blood pressure. This disease also comes with a lot of complications such as fluid buildup, chest pain, permanent kidney damage, and unfortunately, death. What are the treatments of acute failure in case you are wondering? It can be treated only if the underlying cause can be treated, which may be either a blockage of blood flow to the urine or direct damage to the kidneys. It is therefore important to take very good care of ourselves so as to not get this condition. We should also minimize our intake of pain relievers. We shouldn't always run to the pharmacy to buy paracetamol, which most of us commonly buy nowadays, to treat our pain. It's advisable to go to the hospital, consult your doctor, know what's wrong with you, and the proper medications will be administered to you. Too much of these pain relievers have adverse effects on your kidneys, and at the end of the day, your kidneys will suffer this damage. It is also advisable to take very good care of ourselves by eating a healthy diet. We shouldn't always be eating junk foods because they also have adverse effects on our body. This puts a lot of stress on our kidneys when it comes to filtering of their blood. We should also remember to stay hydrated always, because enough water is needed for the proper functioning of our body. This is it for today. Thank you for watching this video, and in my next video I'll be talking about chronic renal failure. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.